the victim of a heart attack? Meet a man who probably would have been, but decided to do something about it before it was too late.
I was out of shape, and there was a lot of cholesterol. And so that kind of signaled something that says, well, that could be clogging up arteries, that could be clogging that heart. So you better do something about it if you want to live longer.
We'll show you the latest techniques being used to diagnose heart disease. We'll let you know the warning signs and what you can do to stop a heart attack from ever striking. Also, do you know the proper way to examine your breasts? The fact is, most women don't, and that's a big problem. We'll show you the right way to do a breast self-exam. It may save your life. That's ahead on this edition of Health Matters. Health Matters is brought to you as a community service by Jefferson Health System. Now, here's your host, Pat Shiraki.
Hello and welcome to Health Matters. On this edition, we're talking about the #1 killer in America, heart disease. It's not just a threat to the elderly. Most heart disease starts much earlier in life, even in childhood. But today, doctors armed with new technology can help detect heart disease before a heart attack. And as Helen Chickering reports, detecting heart disease is the first step toward controlling it.
Baseball, America's pastime, and a full-time job for this man. Jim Paul has been in the baseball business for more than 2 decades. He's the owner of a minor league team, the El Paso Diablos.
My measurement of success is how many people do we draw tonight, how many do we draw for the homestand, how many do we draw for the year.
Making baseball fun to watch has been his key to success. Here, fans get more than a night of ball and a hot dog. There's music and all kinds of entertainment. Jim has seen business go up, down, and through many changes. And Jim has gone through a few changes, too. He's a healthier man than he was years ago when he first stepped on this field. A warning from his doctor was the motivator.
I was out of shape, and there was a lot of cholesterol. And so that kind of signaled something that says, well, that could be clogging up arteries, that could be clogging that heart. So you better do something about it if you want to live longer.
When it comes to his health, Jim has the strike count against him. A strong family history of heart disease, mother, father, and grandfather.
If you're reading the racing form on this horse, is that most likely I would be a likely candidate for that.
It definitely made him a candidate for a thorough heart checkup.
The first thing you do is take a history. With all the technology available, we still have to remember that a good history is very, very important, and a good physical examination.
An important step that helps doctors evaluate a patient's risk for heart disease before a heart attack happens.
Investigators found that when they looked into the background of people who had myocardial infarctions, for example, heart attacks, that they had several things in common. They tended to be smokers, they tended to have elevated cholesterol, high blood pressure, diabetes, and a strong family history of heart disease.
The next step for Jim, an electrocardiogram, a non-invasive test that records the electrical impulses of the heart, and a stress test, which uses an EKG to monitor the heart during exercise. But these tests may not give doctors all the information they need. Today, a more sophisticated tool using the radioactive substance thallium gives doctors a better look.
These are blood flow agents. They go where the blood flow goes. So if there's an area of the heart that does not have a good blood supply, it won't have a good thallium supply either. And we can see that as a defect in the pictures that we take.
Other non-invasive tests include echocardiography. It uses sound waves to produce a picture of the heart's size, shape, and movements.
The imaging has been improved so much that we can look at people's arteries and see things far clearer. We have digital subtraction techniques, computer techniques where we can enhance what we see right on the run.
If a problem like a blocked artery is detected, doctors may perform a technique called a cardiocatheterization. That's when diagnosing heart disease becomes invasive. Here in the cath lab, doctors thread a thin tube or catheter into a vein or artery and pass it into the heart. Dye is injected, and high-speed X-ray movies record the liquid as it flows through the arteries. Here is what a blocked artery looks like, a heart attack waiting to happen.
This calculates out to about a 93% obstruction.
Unfortunately, most of the people who end up in a cath lab have already had a heart attack. even worse, most people who die of heart attacks never reach a hospital. They deny the early warning signs, even the symptoms of an attack in progress. Pain or pressure in the chest, jaw, left arm or back, sweating, nausea, or shortness of breath. But not all these warning signs occur in every heart attack.
So if you have any suspicion that you are having something related to the heart, we would prefer that you come in and see us.
Jim Paul understands the importance of early detection, and he's taking another step in the right direction: prevention. Exercise is a regular part of his daily routine, and he watches his diet.
Indeed, what you do with your life is important, and you can't sit back and let someone else take care of you with all the fantastic technology.
I don't know that it's going to make me live 4 or 5 years longer, which is fine, but I think I'm going to live a lot more fuller and a lot more healthier, and I think that's more important.
For Jim Paul, success is much more than a winning season. This is Helen Chickering reporting.
Now, joining us here in Philadelphia is Dr. Henry Mayer. He is a cardiologist from Bryn Mawr Hospital. Thank you, doctor, for being with us. As we watched Jim Paul's story, I was struck by the fact that he was very motivated to have all of his examinations because he had a family history. Should every individual be this concerned?
Well, I think if strong family history is a place to start, but there are people who, when you look at them and you can judge that this is a high-risk patient. For instance, those who do very little activity, those who are overweight, particularly those that have diabetes, those who smoke too much, maybe those that have high blood pressure, and of course those that's cholesterol may be high and maybe some of the fractionation of their cholesterol is abnormal. Those are the kind of patients that really are at risk. And anybody who really is out of shape and who has not been exercising, who plans to do those kind of things, again, is a high-risk patient.
Do these same guidelines apply for men and women?
I believe so. Women do have protection from the hormones, and earlier in life, they tend not to have as much coronary artery disease as their male counterparts, but they do catch up as they go through life changes.
Now, let's say that we have a problem and you need to be able to have some diagnostic work done. We know about a stress test, we know about a cardiogram. It sounds very intimidating to hear you need a thallium stress test and you need an echocardiogram. Should a patient be really concerned when they hear their doctor ask for that kind of test?
I don't believe so. I think most of the tests we do now, including cardiac catheterization, are really safe. They've progressed over the years. Our techniques have progressed. The people doing them are much better at it, and the equipment is better. For instance, a stress test itself has extremely low risk because you're doing it under monitored conditions. And that's one of the things you're trying to determine. Can the person tolerate stress? If there are changes or abnormalities, you're right there to treat them or get them off the treadmill. Echocardiography is using sound waves, and at this time there's been no risk from sound waves to the patient. Cardiac catheterization is definitely a more invasive test, but again, in 1990s, it's a safe test, and I believe it's safer than than a lot of other things we do.
We've heard an awful lot about some of the symptoms that exist when you have a heart attack, with the sweating, with the chest pain, with the upper arm pain. Are there, though, atypical symptoms that you really should be carefully watching? Are there unusual symptoms besides these standard ones that we hear about all the time?
Our classical patient is somebody who every time he gets under stress, goes out in the cold, exercises, gets some kind of chest discomfort. It may involve his jaw or his arm. Now, that's the classical ones. And percentage-wise, I can't give an exact percentage, but obviously it's more in the majority. But there are a lot of patients that have unusual symptoms. And it may be just exertional weakness or weakness itself, who just don't look well and have not been doing well. Many times the spouse will say, I don't like the way my husband looks. There are those who get arm or even hand or elbow pain, and it may be related to the heart. So there are atypical presentations.
How important is it, if you in fact feel that you are expressing a symptom of heart attack, how important is it for you to immediately have attention?
Generally, it isn't that important at that moment. Most patients who come to the physician have experienced symptoms for a while. Like most of us, they probably ignored them in the beginning. Then they became more concerned, and then they sought attention. There are a group of patients who present to you suddenly with a heart attack, etc. Many of those, or very few of those, will have warning. So I think if you're having concerns or a family risk or some of the risk factors we talked about, I think you have time to get to see the physician, and he or she should begin by evaluating you with laboratory tests, x-rays, stress tests, good physical exam.
Tell us a little bit about the clot-busting drugs that are available now in the marketplace.
The clot-busting drugs basically are thrombolytic drugs. Anytime a clot forms, it forms a mesh of thrombin. Thrombin is like a fibrous structure, and it forms a very tight clot. We believe at the present time that most acute heart attacks come from a thrombus forming right in an area of narrowing in the coronary artery. If this is the cause, which it sure appears to be in most of the studies, then it would make sense if as soon as possible you can inject an agent that will look at this thrombus and now dissolve it. Our own body will do that, but it won't do it in such a way that we might by injecting these drugs. So now it becomes very important that if it's early in the course of your presentation, to get to a hospital so something like that can be given. Seattle experience has been that if you do it very early, sometimes you reverse a lot of unnecessary heart attacks.
And that's the good news. Dr. Henry Maier, thank you very much for joining us. Still ahead on Health Matters, the most important first step in fighting breast cancer. We'll show you the right way to examine your breasts. Plus, on our Health News Wire, eye drops and contact lenses don't always mix. We'll tell you why when Health Matters returns.
Simple changes in lifestyle can protect your heart. For free information on keeping your heart healthy, call Jefferson Health System at 1-800-539-6334 or 1-800-JEFF-NOW. We'll repeat these numbers later in the program.
That's not for me, is it?
Shopping for lunch is such a joy.
Tuna, what am I, a cat?
It's a thankless job.
No, please, not that.
And everyone's got an opinion.
Aren't I allergic to that?
Fortunately, there's Lunchables lunch combinations from Oscar Mayer. Their best meats, cheeses, crackers, even a juice drink.
Thanks, Mom.
Sure to draw rave reviews from the toughest critics. Lunchables from Oscar Mayer. Lunch will never be the same.
I'd like to offer you a better life, one of enjoyment and relaxation, safely protected from bad weather and insects. We're Patio Enclosures Incorporated, and we'd like to turn your dreams of a casual, relaxing lifestyle into reality with a new patio, porch, deck enclosure, or solarium. Come to our open house and see 6 full-size decorated sunrooms and learn that a good life is truly affordable.
It's been a tough year for O.J. Simpson. Now there might finally be someone else to point the finger at. Celebrity lookalikes caught in scandal. Look at these mannerisms. They're just like O.J. on the next Maury.
Monday at 9 on KYW3. These cheating husbands
I thought we had something.
made their mistresses mothers.
I wasn't losing nothing. I wasn't cheating on anyone.
And boy, are their wives mad.
Next, Sally.
Monday at 10 on KYW3.
Right now, somewhere.
Sleazy operators are bilking victims out of their hard-earned cash.
Right now, somewhere.
They're trying on tomorrow's fashions.
Right now, somewhere.
A father's healthy lung offers his dying daughter a chance to live.
And right now, there's a new TV show, Day and Date. The most provocative, compelling stories on television. Join Dana King, Patrick Van Horn, and Dr. Nancy Snyderman for Day and Date. It's live with the latest.
Premieres Monday at 4.
You're watching Health Matters, KYW3's weekly health news magazine.
Now for a look at the items making this week's Health News Wire. The bra you choose may be giving you a headache. Rob Vaughn has tips for beating the pain.
Your bra straps may be giving you a headache. Physicians say wearing thin bra straps too tightly may damage the cervical nerve. That's a nerve that runs along the shoulder, and pressure on that nerve can lead to neck pain or headaches. Eventually, the pain can spread to the arms and hands. Doctors say women should choose bras with good support and wide straps to distribute the weight more evenly. Beware of eye drops that take the red out. They may put the yellow into your soft contact lenses. The American Optometric Association says using eye drops over a long period of time will turn your soft lenses yellow. They also say these drops are not good for dry eyes. Dry eyes need a lubricant, which these over-the-counter drops don't always have. Aching joints shouldn't keep you away from exercise. Doctors once recommended that arthritis patients avoid exercise for fear of further damaging the joints. But now, doctors say exercise combined with a regular treatment program can improve the health and fitness of arthritis patients. But don't overdo it. It's best to work out at your own pace. This is Rob Vaughn for the Health Newswire.
Now it's time to check your medical IQ with our weekly health quiz question. This week, we want to know, why do we get hiccups? Stay tuned for the answer. And after that, a how-to guide for examining your breasts. The information could save your life.
Now CBS is on KYW3. Any questions?
What's happening in prime time?
Good stuff. Really good stuff.
You'll see Murphy Brown.
The Nanny.
Picket fences.
What's on late night?
You can count on me to still be here at 11. Then comes David Letterman.
Letterman? I love Letterman.
Any questions? Call us at 1-800-KYW-is-CBS or check the TV page in your local paper.
You know, me and Larry Kane are brothers.
Don't get like this, please. You're so jealous.
Don't get like what? No, come here. Don't get like what?
I didn't mean anything. It's just to get so angry.
That's enough from you. Enough. 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 That's enough. I'm going to give you something to scream about. Get over here. Get up.
I can't.
I'm talking to you. Get up.
I can't get it off.
Stop crying! You're asking for it again!
For information about how you can help stop domestic violence, call us.
Health Matters is brought to you as a community service by Jefferson Health System, because your health matters.
Now here's the answer to our weekly quiz question. You remember we wanted to know, why do we get hiccups? Here's the answer.
A hiccup really represents a signal from your brain that goes down your phrenic nerve to your diaphragm that makes us take a huge inspiration through closed vocal cords, forcing the vocal cords open. That's the noise. Why do we hiccup? Most of them come out of the clear blue. You can provoke them with tickling, laughter, aerophagia, swallowing air, some foods, drinking alcohol, and tobacco smoke. I'm Bill Phelan. Thanks.
What is the most important thing a woman can do in the battle against breast cancer? Regular professional exams and routine mammograms are important, but a self-examination of your breasts is the first line of defense in the fight against breast cancer. Yet most women don't know the right way to do a breast self-exam. Reporter Amy Burkett has information that could save your life.
Breast self-examination is a very important part of every woman's routine, standard health care.
The problem is,
most women do not know how to do breast self-examination correctly.
the best thing a woman can do is attend an approved training class. However, we can show you the basics behind a good exam. Begin with a visual inspection in front of a mirror.
The first step is to put your hands over your head and all as high as you can go, and to notice any contour changes of the breast or any skin changes or any dimpling on the breasts. And then after that, you want to bend over at your waist and see if you can notice any changes.
Next is the fingertip exam. It's best done lying down with a pillow under the shoulder of the breast you are examining. Start under the armpit and work your way across and down the entire breast. Use the pads of the 3 middle fingers, sliding them in a circular motion. A little lotion will make it easier to slide the fingers from one area to another. Don't lift the fingers from the skin. You may miss sections if you do. It's important to use 3 levels of pressure. Start at the surface, then check a little deeper, and then apply firm pressure.
It's hard to get the hang of the fingers, but once you do, it's good.
How am I doing?
Perfect.
Good.
Yeah, good. Because you're not missing any tissue.
What should you look for?
If there's a change in it, change in the size of it, a change in the shape in it, a change in the texture of it, how hard it is, that's a change that she needs to be able to identify.
So it's important to do the self-exams on a regular basis to get to know your breast. But familiarity is not the only advantage a woman has when examining her own breast.
The woman has the advantage of being able to feel the breast not only from the outside through the fingers, but she can also feel the breast from the inside. And so she knows what the breast feels like when she puts pressure on it.
Dr. Carlson also suggests doing the exam at the same time every month because some women have changes in their breasts associated with their menstrual cycle. If you find breast cancer early, it usually allows for more treatment options and even for less extensive treatments. And that's the whole point of doing the exam in the first place. This is Amy Burkett reporting.
Joining us here in Philadelphia is Dr. Emily Conant, a radiologist from Thomas Jefferson University Hospital. Doctor, thank you so much for joining us. Are, in fact, more and younger women developing breast cancer?
Well, more women are developing breast cancer. The incidence is increasing, but as we look earlier with early detection, high-quality mammography, we're finding cancers at a stage that they're more likely to be cured.
What role does family history play in breast cancer? Should a woman who has a mother or an aunt or a grandmother who developed breast cancer, should they be concerned?
They should certainly be concerned. They're at higher risk. But the fact is that most women that are diagnosed with breast cancer, 75%, do not have a family history. Women, however, who have a mother or sister with breast cancer should seek help, should get early detection with mammography. But they're not the only women that get breast cancer.
Let's talk about the importance of self-examination as the first line of prevention. How critical is it that a woman really understand how to examine themselves?
Oh, it's very important. I think that women really should begin examining themselves in the teen years when they develop breasts so that they're comfortable with what the breast feels like, how the breast goes through changes as they age with pregnancy, postpartum, and then with menopause. So it's a continuum. But women should become comfortable with examining their breasts. They're really the person who may find the first change, the most important change.
Well, there is also a great controversy about mammography and mammography guidelines. Who should get a mammography and who should not?
Well, it is very controversial. All women should examine their breasts, and all women, we believe at Jefferson, should have mammograms yearly after the age of 40. We've actually done a lot of research on this question at Jefferson and looked at women who did develop breast cancer and then how frequently they had mammograms prior to the diagnosis. We found that women who had yearly mammography were the women who had cancers at the earliest stage, the most curable cancers. Even women who had mammography every 2 years had worse cancers. So we really believe strongly in yearly mammography for anyone after 40. But again, it is complementary to breast self-exam. It takes both.
In your practice, what are some of the most common questions and concerns that women have about breast self-exam?
Well, women are afraid to examine themselves. They're not sure what they feel. They feel lumps all over the place, they say. It can be a difficult examination, but the important thing is to become accustomed to what one's breasts feel like. I often describe to women that their breasts feel like tapioca or cottage cheese or oatmeal, and that's okay, just so long as they continue to be that way. You don't want to find a raisin or a grape or an M&M, but to get used to what the normal feeling of your breast is and how it changes over time. And then I think a woman is able to detect any significant change, anything she's concerned about is what she should approach her doctor.
Tell me about treatment options.
Well, I think the most important thing about treatment options is the size of a cancer, and obviously the earlier a cancer is detected, the more treatment options a woman has. We hear a lot about lumpectomy and radiation therapy and then chemotherapy, but a woman who has a small cancer detected at an early stage has those options.
What's the best advice for all women across the board as far as breast cancer is concerned?
I think seeking out quality mammography, having mammography yearly from 40 on, and doing a monthly self-exam. Those two complementary studies are the important key.
Great. Dr. Emily Conant, thank you very much for joining us. And we'll be right back after this.
Knowing the correct way to examine your breasts can be a matter of life and death. For information on breast self-exam, call Jefferson Health System at 1-800-539-6334 or 1-800-JEFF-NOW.
Imagine a dream machine that burns fat, tones muscles, improves flexibility, works your entire body to help you look and feel entirely better in just 20 minutes 3 times a week. The dream is a reality at Sears today with the Lifestyler CardioFit. CardioFit can burn more calories faster than treadmills or stair climbers because it works all your muscles at once. Adjust for a deep muscle workout or reduce tension to burn fat and increase cardiovascular endurance for a health club quality workout at home. It's quiet, compact, and unlike running in aerobics, it's no impact, easy on joints. Now imagine the price. $400, $500? Imagine this. $199.99, and Sears will be there to back it up. Trust Sears. We sell more units of exercise equipment than any other store. Call to learn about the Lifestyler CardioFit or come to Sears and try it for yourself.
It's been almost 14 years. Nearly 4,000 mornings. Dozens of snowstorms. Millions of showers. Plus, countless cups of coffee, scrambled eggs, and scrambled roads. But one morning newscast gets you through all of it, every weekday at 5:30. With Tom Lemaine's Franklin Institute forecast 13 times every morning. John Valerio's traffic cam reports every 15 minutes. And Brandon Brooks' 21 years of news experience. Together on News 3, we'll always bring you 2 things. Coverage and a smile you can count on.
KYW News 3 this morning with Pat Shiraki. Coverage you can count on.
Is something going on between Sharon Stone and John F. Kennedy Jr.? Sharon tells E.T. the scoop. Plus, meet Peter, Mark, and Gil, the sexy hunks of Central Park West, on the next Entertainment Tonight.
Monday at 7 on KYW3.
Remember, early detection is your first line of defense against heart disease, and the proper technique for breast self-examination can be your first line of defense against breast cancer. Next time on Health Matters, find out how women can live longer, healthier lives. I'm Pat Shiraki. Join us then, because health matters.
Health Matters is brought to you as a community service by Jefferson Health System, because your health matters.
People are counting on KYW News every day. You have to be up early. For the first news, weather, and traffic of the day, who do you think of? It's Saturday morning. You'd like to watch something other than cartoons. Who do you think of? It's 4 p.m. One station brings you local news an hour before anyone else. Who do you think of? For real stories of the people who live here, of the places we call home. Who do you think of? Today, more and more people are thinking of the combined resources of KYW News 3 and KYW News Radio, working together for coverage you can count on.
Sunday nights on CBS begin at 7 with 60 Minutes. Stay tuned for mystery and drama beginning at 8 with Murder, She Wrote. And the CBS Sunday movie, Only the Lonely, starring John Candy at 9. Tonight on KYW3.
They're back. The terrible childhood diseases. They can cripple, choke, even kill. Only one thing will stop them: immunization. For more information or to get your child immunized, contact your pediatrician or call the Philadelphia Department of Health at 686-1776.
KYW3 is now your CBS station.